Started. So, hello and welcome, everyone. My name is Kaylee McCauley. I'm a registered dietitian and the Health Promotion and Research Manager here with Celiac Canada. I'll be your host for tonight's webinar. We're so glad that you could join us. Again, we have an amazing turnout for this session. It just shows how much interest there is in this topic, learning about probiotics and celiac disease. So, just a quick housekeeping before we begin. Tonight's session will be recorded, so the replay will be available afterwards. If you registered, you'll get sent the recording in your email along with a survey, so please fill that out. Please use the Q&A box at the bottom of the screen to submit your questions. We'll answer as many as we can at the end of the session. If you have any technical issues, feel free to send us a message in the chat and I'll handle that. So before we get started, I want to extend a big thank you to our premium sponsor, which is Odo's. Their generous support makes this webinar series possible. Odo's is committed to supporting the gluten-free community by providing safe, nutritious, and delicious products, from breads and buns to flatbreads and more. Now I am thrilled to introduce our speaker, Dr. Ines Pinto-Sanchez. Dr. Pinto-Sanchez is an associate professor at McMaster University, a gastroenterologist, and a certified nutrition support clinician. She is the director of the Adult Celiac Clinic within the Gastroenterology Division at McMaster University, supporting the Farncombe Nutrition Initiative. Her research focuses on nutrition in gastrointestinal inflammatory conditions with a particular emphasis on celiac disease therapies and the nutritional adequacy of the gluten-free diet. Dr. Pinto-Sanchez is a leading expert in this field, and we're so fortunate to have her with us tonight. Dr. Pinto-Sanchez, welcome, and thank you so much for joining.
Thank you very much, Kali, for organizing this, and Celiac Canada and the sponsors and everyone for joining today. So it is can you see my screen? I will just put it in full screen mode. Can you see my screen?
Perfect. Looks good.
Excellent. So it's amazing to see everyone joining all over Canada. And also I'm seeing people from Florida, from all over, the place. So it's great to have you here. So what we're going to talk to you today is about probiotics in celiac disease and what the science says, because there is a lot out there. So these are my relationship here. So what we're going to review today is concepts of microbiota, probiotics in celiac disease, and we want to learn what type of research study have done to evaluate whether probiotics is effective in celiac disease, and what recommendations are out there on when probiotics can be used in celiac disease. So let's start with the first concept of microbiota. And as everyone knows, microbiota are the group of microorganisms. It's not just bacteria. It is bacteria, viruses, fungi, phages that are part of our biome that are in our body. So when I'm saying our body, is not just in the gut, right? So it's not just gut microbiota. There are bacteria, virus, fungus, fungi in all over our body, in our nose, mouth, in our stomach, in our respiratory tract, in our skin. What I must say is that from all the microbiota, the one that resides mostly is in the gut. And in the gut, there is not the same concentration of microbiota. There are bacteria, fungi, and viruses in the GI tract, but it's more concentrated in the colon. As you will see there, this color meant that the stomach will have less bacteria and viruses and fungi that in the colon. The colon is where the microbiota is more concentrated. So, and all these microorganisms are not the same. There are some are more beneficial. They have all these bacteria. they have a specific function, and each of them has specific function. That's why there are some more beneficial and some other are not very beneficial, and they're more pro-inflammatory. So what is important, for example, lactobacillus is probiotic bacteria, and Akkermansia has been involved in mucus degrading bacteria. There is also this Faecalibacterium prownitzii, produce short-chain fatty acids, so it's a beneficial effect and has been linked as a potential benefit in inflammatory bowel. These Ruminococcus is just a health promoter, a bacteria. And there are others that are more like pro-inflammatory, for example, E. coli. This is more pathogenic. Of course, there are multiple different species, and some of them are pathogenic, some others are not. So C. diff is a very well-known toxin producer, so it is linked to disease. H. pylori is another bacteria that has an inflammatory effect that is usually sitting in the stomach and likes very much the acid and produce inflammation in the stomach and gastritis, ulcers. And also Staphylococcus is another opportunistic bacteria that produce disease and diarrhea in people. So those are examples of how good bacteria, bad bacteria can affect our body. And it's not just the type of bacteria, but also the balance of these good and bad bacteria, or beneficial and harmful bacteria. When we say that there should be a balance between these bacteria, it's difficult to determine what is a good balance, right? So that's why it's more individual based, and that's what we doing or testing these bacteria is not easy to interpret, because there is no good range of normality. So each one individual has their own bacteria. Of course, some of them is driven by the genetics, but not only genetic is driving the bacteria. So when the baby is unborn and is the womb, the mother drives all these bacteria. So the factors that affect the mother, like the weight, the antibiotic exposure of the mother in the womb, affect the unborn baby. But when the baby is born, then there are other factors that affect the bacteria, the microbiota, not just bacteria. For example, it's how the baby is fed, and the delivery mode of the baby, and also if they are after they start this baby start moving, there are other factors like when they introduce solid food versus formula or breastfed, antibiotic exposure. And then when these persons start growing, and toddlers, adults, and elderly, there are other factors that affect diet, exercise, stress, antibiotics, medication, supplements, the nutritional status, everything impact the microbiome. So, and what about these changes in microbiota in celiac disease? Well, we know that genes and gluten are necessary, but not sufficient to cause celiac disease. So other factors, environmental factors, one of them is changes in gut microbiota, has been implicated as a risk factor for developing or trigger celiac disease, and also to persist celiac disease. So the persistence of the activity of celiac disease is somehow related to these changes in gut microbiota. And there are multiple studies in celiac disease evaluating the gut microbiota. And in terms of bacteria specifically, an increase in bacteroidetes, Proteobacteria and E. coli has been associated with celiac disease or with active celiac disease, and a decrease as well of beneficial bacteria like Lactobacillus, Bifidobacterium, or Faecalibacterium prownitzii. So, and what is the role of these bacteria or the microbiota? Well, all these microbiome is involved in digesting food, and also in the synthesis of nutrients and metabolites. Also are involved in binding, sometimes binding like nutrients, for example, iron, zinc. These are typical nutrients that are digested by these bacteria. And also they modulate the immune system, and they also are involved in maintaining the intestinal mucosal lining. So that's why any disruption of this mucosal lining or the gut lining, it can be done by, for example, infection or viruses infection. So what we know in celiac disease is that there are specific factors that influence gut bacteria or the concentration of these bacteria. For example, the celiac disease immune activity, if the celiac is active or not, if the gut is inflamed or not. Also, once the celiac is treated, for example, when person started gluten-free diet, gluten-free diet is not just one diet. It depends on the food composition. So if a person eats more fiber, for example, or less fiber, or they're more ultra-processed food, they will change the gut bacteria. And additional factors is age. There is a difference in gut microbiota concentration, bacteria concentration in adults versus children. And also the methods to detect this bacteria concentration that have been changing throughout the years have led to different results in concentration of these bacteria. And also very important that we discovered, Dr. Perdue did this study that I'm going to show you now. And thanks to our, kind patients that participated in this and donated extra samples to check gut bacteria, Dr. Verdú shown that there is a different concentration of bacteria in across the duodenum areas in celiac disease. So the location where we take the biopsies, if we take in the very first part, or we take the last part, or if we collect the bacteria in stool samples, it will change. The concentration of bacteria will change. So that's what is so important. And that's why the studies evaluating gut bacteria or probiotics are so different depending on how we measure them. So we know that a strict gluten-free diet is key to maintain the celiac under good control and to promote this villi growth. However, we know that it's so difficult to do a gluten-free diet, to be very, very strict and avoid gluten completely is very challenging for so many reasons. And that's why, in part, 30-40% of people with celiac disease, they still have symptoms despite being or attempting to adhere to a gluten-free diet very strictly. So that's why there has been a lot of research in the last decade, specifically out beyond a gluten-free diet, to trying to maintain or to improve the gut healing, and also to maintain the celiac under good control, and also to be able to control symptoms much better. So some of the therapies, they have been working on improving symptoms, others in trying to digest gluten inside the gut, others to try to see if people can tolerate gluten. And there has been a growing interest in see how we can change in the gut bacteria or modulation of this microbiota can improve these parameters. And these were probiotics came. So probiotics, prebiotics, postbiotics, you may have heard these words. Probiotics are bacteria, right? Beneficial bacteria that it needs to be live bacteria that has a beneficial effect in the gut. Prebiotics is more related to the food for these bacteria. So for the good for the probiotics, those are the prebiotics. And postbiotics are part of bacteria, fungi, or byproducts of these bacteria or fungi that have a beneficial effect. So any of these parts can be involved or used as a therapy to improve in celiac disease symptoms or digestion of gluten. So what we're going to focus today, and the focus of this talk, is the probiotics. So this is the beneficial bacteria. And this is maybe interesting, and we are seeing several hundred people join the webinar because there is a lot of interest in probiotics. In fact, in the last 10 years, there has been a growth of consumption of probiotics in celiac disease. In this study that was published in 2014, so the survey was done before then, so more than 10 years ago, 24% of celiac patients were taking supplements, and the majority of these supplements were probiotics. So that was higher than a general population. And the more recent study published like a couple of years ago, they showed that 1/3 of U.S. respondents in Columbia University in New York, they were taking probiotics. So again, more people with the years have been taking probiotics for different reasons. So to improve health, to improve symptoms, or to try to make to feel better. And what are probiotics? Probiotics are live microorganisms that when administered, so it needs to be live, right? So that when we administer in adequate amounts, they have a health benefits. So there are multiple probiotics, multiple strains of probiotics, multiple strength of probiotics, and the most commonly used are Lactobacillus, Bifidobacterium, Saccharomyces, Streptococcus, Enterococcus, and E. coli and Bacillus. And they have different species. So this Lactobacillus bifidobacterius is a genus, and there are different species or different type of these bacteria, and not all of them are the same. They have different function and different efficacy depending on what we are looking for. So what are how these probiotics work? Well, it depends on the genus, on the species of these bacteria. They may impact growth of other microorganisms by growing, or by increasing the concentration. They may impact the growth of other bad bacteria or harmful bacteria. They may detoxify gluten. They may digest proteins or have what we call proteolytic activity. They may have changed gut permeability. And we know that increased permeability is the key factor that leads initially that triggers the celiac disease. They may modulate the immune response or the immune system. They may produce some biofactors or metabolites, for example, histamine, methane, tryptophan. They may degrade tryptophan. Those are key factors in the inflammation process. So the effect of these probiotics will depend. They may be non-specific. For example, that the fact that they impact in the growth of other organisms applies to mostly any probiotic, but there may be more species-specific or strain-specific. For example, some species may synthesize some vitamins and improve nutrition, or may impact gut barrier. Some others that are more strain-specific may produce some specific markers, pro-inflammatory markers, or decrease of pro-inflammatory markers acting. So again, each probiotic has different effects. And sometimes, that's why you will see in many of these probiotic commercially available, there are combination of these good bacteria to amplify this response. So how we come up with which probiotic is the best? Which one? I get this question all the time. Which is the probiotic I should use? And to test this question that seems quite simple is not simple. There are multiple studies, preclinical, clinical studies, and we need to start to understand the mechanism. So to understand the mechanism, so how this probiotic work, we need to do preclinical studies. And there are different types of preclinical studies. You can start in vitro, which is the petri dish there that you see there. So not even in animals, it's just in the petri dish. Or you can do studies in animals and in different type of animals. And then that's to prove that the probiotic works, how it works, and also that it's safe. And then you can do clinical studies, you can do observational studies, or you can do randomized controlled trials, and I will explain a bit more on that. So from the preclinical studies, examples of this is, for example, these two studies that they were studying these bacteria, and they observed that these bacteria, Lactobacillus, breaks down small part of gluten when added to the sourdough, so then they reduce the concentration of gluten. So they were studying in animals in a sourdough bacteria that was studied to reduce the level of sonulin, which is a key protein involving gut permeability. Again, not trying animals, not trying people, just there in the petri dish or in the sourdough or in the food. Then there are other examples of mouse studies. For example, this probiotic Bilongum bifidobacterium, that's part of bifidobacterium, that was producing a serpin, which is a molecule that reduces the gut inflammation. And another of these probiotics, these two probiotics, had been tested in mouse model preclinical studies by the group of Dr. Verdu and Dr. Caminero at McMaster. They are very well-known experts in this area and has been doing a lot of preclinical studies and some clinical studies as well. In this second probiotic, the Lactobacillus, they degrade these amylase trypsin inhibitors, which is a second most common proteins in wheat, and that has been in conjunction with gluten. known to induce inflammation in an exponential way. So they also, the group of Dr. Verdu, shown that bacteria-derived metabolites may reduce inflammation induced by gliadin, by gluten. So these are preclinical studies and see how each specific probiotics may work and what are the mechanisms. So these early findings, when we have this study, when we see a paper with these preclinical studies, is very exciting. And we say, okay, so we have a mechanism, possibility that this work in celiac disease. But this is too early to say that this specific probiotic works. So we need to go to the clinical studies to prove that this actually works in people. And this is what we need, these clinical studies in humans to confirm this effect, because the result that you see beautiful in a preclinical study may change when you expose different individuals. So this is where the clinical trials come up on probiotics, and there are different clinical trials, different way of doing clinical trials. We can do observational studies, which means that we can see, for example, who is taking probiotics and what effect it has, right? So someone that decided to take probiotic, we can study those population and see what effect it has. The problem with doing that and not doing an intervention study, which means that we are giving that in a controlled way, is that when the person decides to take that probiotic, there are many factors that can affect those results. So there may be some what we call bias that may not be like a real results. So the best way to prove that a drug or a treatment works is to conduct a randomized controlled trials. And those who participate in clinical trials, they know this very well, because this is the most common and challenging to use, but it's the best way to prove that a drug has an effect. So a randomized controlled trial is a type of study that is used to test whether a treatment actually works. And it's considered the gold standard in medical research because it reduces bias and helps ensure that the results are reliable. So what the randomized controlled trial does? It gives to some participant by random, and this is the key. Random means that the participant, by participating, you have the same chance, like saying that the same chance to receive the treatment or the control, which is most commonly the placebo. And the placebo is very important, very important. It's something that looks exactly like the drug, but it doesn't have the drug and it doesn't have an effect. So if someone improves on a placebo, which happens a lot, that means that that's not the real drug effect. And that's very, very important to prove that the real drug is way more effective than the placebo. Right? So that's the key, and that's a way to prove that something works. So, and then this randomized trial, again, is the gold standard. And that's the best evidence to see if a probiotic or any drug works. So then there are systematic reviews. Systematic reviews is the level 1 of evidence. It does a very rigorous review of all the studies, and they pool all the studies together. And the highest top level evidence that something works or not is having a systematic review of different randomized controlled trials, because then you pull a lot of different studies, you increase the number of participants, and if you do that in a very rigorous way, you have multiple rigorous studies and pull them together, and then you have an evidence if this works or not. So we did this several years ago, this systematic review for randomized controlled trials. And as you will see here, we published that in 2020 with a very talented PhD student at that moment. Now she graduates and she's a doctor. And at that moment, we review what was the evidence of probiotics in celiac disease. And you will see there in the table, there were at that moment 8 studies, and 4 in children and 4 in adults, 4 randomized controlled trials, right? So each of these studies had different numbers of people and different interventions and different outcomes assessed. So what were the outcomes that they were assessed mostly in these studies? Well, some of them assess gastrointestinal symptoms, some others quality of life, some other inflammation, some other the effect of probiotics in intestinal barrier, some others in blood work and see if the celiac markers decrease, some others they assess whether there were changes of gut microbiota in probiotics versus not probiotics. So those are the outcomes that were evaluated. What we must say is when we pull these studies, we are dealing with different studies design and populations of probiotic uses. So that's something we account in this analysis. So what we came up, this is the typical graphic of these systematic reviews and meta-analysis, highest level of evidence. So what we do here is we pull all these studies together. And if this diamond that you see there in the middle touches the line, it means that there is not much effect. So the reason is because the effect can be for in favor or against this effect. So as we will see here, there was not much effect, but the reason why we found that is there was a lot of heterogeneity between these studies that we pulled. But when we separate by the tool that they used to evaluate symptoms, we saw that there was a significant effect of probiotics. So again, taking this into account for only 2 studies, there was an effect in symptoms. So, and then when we separate the tool that we use, we'll see that the heterogeneity of these studies is reduced, which means that the results are more comparable. So the first conclusion we did by this reviewing the studies, is that the probiotics may be effective. And when I say may, is because we did all this separation, right? So we separated two studies out of these 8 studies, and they may be effective as an adjuvant to the gluten-free diet to improve symptoms in celiac. However, due to the limited number of clinical trials and the difference in these study designs, we are limited in our confidence. We cannot say yes for sure, 100%, right? It's kind of okay, it may be, but still we need more data. So then we are currently updating this systematic review, and this is a very talented student working with me at McMaster, and this is here that Josan, and we decided that we're going to do an update on this review because the previous one is a little bit old, and there has been several studies that appear since then. So we wanted to clean those and see what are the studies on what new RCTs or randomized control trials have appeared since then. So here they has been doing this with Griffin Carr, another student, and they have reviewed 7,000 studies, and some of them were duplicated. So after removing all the duplicates, there were 16 randomized control trials. 8 of them were in the previous review, and 8 of them were new. So they are doing right now all the analysis and pulling all together to see if what we saw before is confirmed or not. So coming soon. But one of the things that we noted here, these are the new studies that were not in the previous one, is that, again, the half of them are in children, half of them are in adults. But if you will see from these studies, there is one study that is a randomized control trial, but it doesn't have a placebo, right? So if you don't have a placebo, then we are questioning whether that's a real effect or not. So then we likely are not going to include this study, even if it is published. And then the other study is published only in abstract format. So we're trying to contact the authors and see if we can get more information to be able to consider that study in the review. Again, this is a lot of work to see whether what's the evidence on whether probiotic work or not. So other outcomes or other effects of interest was quality of life. And there were 2 studies only in that review that we did that evaluated quality of life. And we can see there is not much difference if someone takes a probiotic or not in quality of life. We also evaluated changes in gut bacteria. Yes, when someone takes a probiotic, that probiotic stays, and then also there is an increase in that bacteria in the stool, which is good from that perspective, because we know that this bacteria is beneficial. So another thing that there are new studies that are coming, and there are other outcomes of interest. For example, this study that has been published in 2021 that have seen that children that receive probiotic, these lactobacillus apparently it's increase over time when it remain unchanged in placebo. So there is a signal there that the probiotic stays actually in the gut. So the other thing that we were looking is to see if this probiotic changes immune factors like TNF. These are pro-inflammatory factors. And what we were seeing is there is a trend to that to see, but there are some bias or some possible red flags that we are seeing there in the study. So we also looked into see whether the probiotics changes the TTG, which is the marker of activity in celiac disease, and also permeability, but there is very, very limited data there. So we cannot conclude much, but there doesn't seem to seem a difference there. Another very, very important factor when we look into what's the evidence on probiotic is to see what are the mechanisms. So in this study that, I remember that was done, the original study was done by the group of Argentina, Dr. Julio Bay, Dr. Edgardo Smecol, and all this team. They evaluated the effect of this probiotic, but what is interesting is that when they do also not just the probiotic itself, it is effective or not, but also they look into that, how it works. And when they were looking here, and what they found is that this specific strain of probiotic that they saw that they maybe have an impact in some symptoms in celiac disease is through production of these defensin, which is an anti-inflammatory mechanism. So when we look into specific bacteria and we see mechanisms, that makes it more interesting because we understand if work and how it works. And this is another example. Dr. Verdu has been looking into this for years, and how a probiotic bacteria, for example, in these studies in Science that was published a couple of years ago, how these probiotic bacteria it was acting or make potential benefit by breaking down the tryptophan. And so then this is tryptophan is an amino acid. So tryptophan is a mechanism that the Verdula has been investigating as potential therapy for celiac disease and is clearly related to the gut bacteria. So again, these are examples there. And when we pull all this evidence and we'll do these reviews, what we also do is to see how reliable it is for us based on our judgment. And the judgment is made based on a certainty of evidence of the grade. And as we'll see here, even though if we can say that some studies there is a signal that probiotics may improve symptoms, still the quality of the evidence is low, and that's why we are a little bit cautious there not to prescribe probiotics massively, right? So I'm heading now to the end here, and to summarize this question on whether probiotics are good for celiac disease and whether they are good for improving symptoms in celiac disease, based on all what I showed before and all the evidence that we gathered there and we have been working throughout the years, is there is limited data despite many studies have been published. Not all the studies can be ranked in the same way. So, but these data that we show suggest that probiotics may help to control symptoms in patients with celiac disease who adhere to gluten-free diet, right? So it's not to replace gluten-free. It is in those who adhere to gluten-free diet and they have persistent symptoms, it may help. So, and someone can ask, okay, that's good, it may help symptoms, but what about safety? Are they safe to take, right? So on those studies that when we did the systematic review, we didn't see any concerns on safety. The adverse events of probiotics were similar to placebo, so no higher side effects there. But what is very, very important, I want to make this clear here, and I want to warn everyone, it's we need to ensure that probiotics are gluten-free, right? So, and I'm bringing this based on a study that was done in the Columbia University, Dr. Samantha Nazareth years ago, like that was, I think, published as an abstract format in 2015. They purchased 22 of the most popular brands of probiotics, and they tested the composition by mass spectrometry, which is the highest and the most accurate test to test gluten there. So what they found is that 12 of these 22 probiotics contain detectable level of gluten. Two of them, again 10%, two of them exceeding the FDA gluten-free labeling standards. So we can say that probiotics are safe, provided that they are gluten-free, right? So then if we're going to take a probiotic, if someone prescribes a probiotic, needs to make sure that it's gluten-free and it's a reliable brand that we can rely that label. So to summarize the effect of probiotics in celiac disease, what I want to bring here, and I hope that I pass this message, is probiotics are not for everyone. So not everyone has to take a probiotic. And this question I have very frequently in my clinic. My patients are asking me, do I need to take a probiotic? Right? So it's not for everyone. Who should take a probiotic? They may help to people that are doing a gluten-free diet and they still have some symptoms. So not to everyone that has symptoms, but to some people that have symptoms. So it's someone to try. If someone has symptoms, then we can try that. But we need to make sure that the probiotic we're prescribing is gluten-free. And the evidence on the efficacy of probiotics is not yet too strong, and mostly because of the small number of patients that have been included, and because it's difficult to pull all these studies together, because there are differences in the studies design, as I showed before. So we still don't know who will benefit most from taking probiotics, or which exact types or species or strains will be the most helpful. So there is no one single probiotic that we can recommend today. So what we need for this is to carefully design human studies to test specific probiotics. But this is not just, okay, let's grab a probiotic and study this. It needs to be well thought with a mechanism, right? So as what I mentioned, for example, what is doing Dr. Verdu, it says, okay, this is a mechanism possible that could possibly impact in inflammation. Okay, let's see what probiotic can impact on that. Or it's a very well thought on a mechanistic approach rather than, throwing any probiotic there. And this, when we have this, then we can test in population and see who is going to respond, and then we can do more personalized approach, which seems to be the future. So to bridge the knowledge gap, we need to combine these basic research and clinical research for probiotics. And with that, I want to thank, of course, all the support that we have at McMaster, Celiac Canada. We work very closely together, and to support all the research. And also, when I bring that, we have our website, as you will see there. There is a link to our website. We do have research studies that we're doing. If you're interested to participate, you just can go to the website and click, participate and go and research. There is a list of all the studies, and we're going to soon probably start one of these probiotic well thought mechanistic studies. So welcome to you if you want to join in the future. And I'm open for questions.
Thank you so much. That was really interesting. So questions, please leave them in the Q&A section at the bottom of the screen there, and we can read some aloud. So first one, my gastrointestinal doctor said to just take a line probiotic 1 time per day and Metamucil 2 times per day. I've been doing that for a few years. I'm still getting sick, flu-like symptoms, viruses, basically immune system is horrible. Follow a strict gluten-free diet, but of course not perfect. Don't know what to do as I'm so tired of feeling sick.
Yeah. So as I mentioned before, probiotics are not the response for everything, right? So it doesn't mean that it will solve everything. It may help with some gastrointestinal symptoms, but it doesn't mean that it will fix the whole immune system, or it's and what works for some people, it may not work for another, right? So if you take a probiotic for a month and then you still feel the same, that probiotic maybe is not working, and it's not, usually what is known is probiotic work like a kind of a key, and so it's not the same probiotic work for everyone. That's one thing. And again, the reason why someone may feel sick or may have different symptoms may vary between people. from the 40% of people that still have symptoms, there are many, many other associated conditions that can cause symptoms. So it works to investigate what is the cause of that persistent symptoms and talk to your doctor about that. And if that's not working, and say, okay, that's not working, what other things that we can do, what other tests that we can do, right? Is working one-to-one with your doctor and trying to find out what is causing the symptoms. So Metamucil is a type of fiber, a soluble fiber that is usually very helpful. It's a prebiotic that I mentioned there, right? So you're taking a probiotic and a prebiotic. But again, it's if it's not working, it needs to be what's the cause for that.
Mm-hmm. And you mentioned, not everyone should be taking a probiotic. Who would you recommend would be the perfect person to take a probiotic if you were to recommend one?
Right. So if someone is doing diet very strict, there is no, known cross-contamination and
Mm-hmm.
things that we can identify, but has persistent symptoms, and there is nothing else that can justify that, is to try probiotics. And again, when we try one probiotic, doesn't mean that probiotic has to work or nothing else will work. If that doesn't work, I usually say try 3-4 weeks, right? So then,
Mm-hmm.
and if that doesn't work, then it's to try another one if there is no something else that is causing that, right? After
Mm-hmm.
investigating.
Yeah. And okay, I'll get to these questions first.
Mostly
I have some.
symptoms that are mostly related to changes in bacteria are bloating and diarrhea, right? So
Yes.
so those if there are persistent of those symptoms, probiotics may help.
And someone says, I'm not sure if you'll be able to answer this, but what brands of probiotics do you recommend?
I cannot answer brands, of
Yeah.
course. I cannot answer brands, but what I'm saying is that your physician will do in terms of and saying brands that are well known and they're gluten free. Always
Mhm.
check that they're gluten free, right? And
Yeah. And
again,
how,
sometimes it's there are brands that when you have a company that is well known and trusted, it's easier to trust and make sure that it's gluten free.
yes, exactly. And I know there's different labeling laws for probiotics. So what would be like, what should someone look for to know that the product is gluten free? Would it just be asking?
It should says gluten free there, right?
Oh, it does say gluten free.
Yes,
Okay.
yes, yes, yes. Usually it says gluten free.
Okay. Perfect.
The problem is that we don't have good regulations
I
to
know.
reinforce
Yes.
that they say. But if they say gluten free,
Then you
they
know it's
you
good.
know it should be
Okay.
gluten free, because if not, those companies are liable for that. Once you put gluten free, it should meet
Yes.
the standard for less than 20 parts per million.
Someone says, how would one know if the symptoms are from celiac exposure or other, such as high FODMAP exposure? And would it matter in a study?
Mhm. So symptoms are not very specific, right?
Mhm.
So I know that everyone reacts different to gluten exposure. I get from my patients sometimes, there has been studies when they were studying vaccines, or where they were studied, for example, reaction to oats or reaction to gluten. People develop different symptoms. Some people, they don't develop symptoms. Some others, they have a lot of symptoms like vomiting, diarrhea, and the time also is different, and it will depend and how much and how the gluten is taken. It's not the same to get pure gluten or to take gluten in a matrix of food that takes time to digest, right?
Mhm.
So again, we cannot rely symptoms alone to detect gluten contamination. We need to rely on objective measures. And
Yeah.
how we measure that? Okay, so we can measure like a blood markers, like a TTG, DGP. Those are markers that can tell us if the celiac is active. We know that those markers should be negative by 1 year, 1.5 years. So if they are positive beyond that, it's possible that someone is getting exposed to gluten. That's one, but it doesn't tell us when and how and
Mhm.
how much, right? So because those markers take time to develop. There are other more objective markers that detect gluten part in stool, and they are very that they can get, they're commercially available as well, and they can tell you like with a narrow window if you was exposed to gluten or not. Let's say that you're gluten free, and then you test that marker in stool. It looks like a rapid COVID test, If you test that markers and it's positive, it means that you was exposed to something with gluten in the last 2 or 3 days or 4 days max, right? So that's it narrows the window of, and then you know that you got exposed to gluten or contaminated. But it's very difficult to say only based on symptoms. We need more
Mm-hmm.
objective markers. And then we have, of course, biopsies, repeating biopsies, and that's a less specific because of
Yeah.
course, if someone has persistent inflammation after 3, 4, 5 years, it's possible that they are getting contamination and not 100% gluten free, even from time to time. But they cannot tell you exactly when and how, right?
Yeah, and it's harder to get a biopsy as well. Um, okay, perfect. So from Nicole, could probiotics counteract other supplements like magnesium my 12-year-old daughter takes to support sleep?
Hmm.
So could probiotic counteract with magnesium?
There is no evidence of that.
No.
Mhm. Yeah. So
Can
some bacteria can impact some nutrients, but magnesium, I don't think that it was very well studied in terms of probiotics. Um, yeah. So it's interesting, but no evidence on that. So we don't give any recommendations for of taking at different times or.
Okay, perfect. And this one, kind of the same thing. Can probiotics be taken the same time as SSRIs? Or other statins, actually?
So as far as I know, there is no interaction
No
with
interaction.
statins, as far as I know. Yeah.
My daughter, 13 years old, recently had surgery to remove 40 centimeters of intestines due to insusception. Does this surgery affect her gut microbes?
Hmm.
Hmm.
So any resection of the bowels can affect any surgery.
Yeah.
A stress surgery can affect the gut microbiome. But it depends on what part it was resected. Sometimes if there is a resection of the middle and then the part that affects most the microbiome is when you remove the ileocecal valve, which is the union between the colon and the small bowel. That part is
Mhm.
very important, very, very important. So if that resection was far away from that part and it's just in the middle and then they put this together, is less likely that it's going to be affected. But of course, anything that slows down the bowels, that affects the anatomy of the gut, has a potential of change
Yeah.
microbes.
What dosages do you recommend, and can you take too much of a probiotic?
Um, that's a very interesting and difficult to answer question because there are studies done with different doses of probiotics, and the dose that has been more effective is the one that is commercialized, but it doesn't mean that other doses will not work or will be more effective. And
Hmm.
too much probiotic, it may not be good also because well, we can produce too much bacteria, even if it's beneficial, it may not be as good as well. So that's why what the recommendations of each dose of probiotic is what has been studied for that probiotic.
Okay.
So that's what we recommend to go through the prescriptions. And again, each bacteria is different, and each
Yeah.
concentration is different. For 1 billion, 10 billion, that depends on the strains and the combination of these bacteria.
From Tate, there are many probiotics out there with varying levels of billion of SFUs. What is the right amount for someone starting to take a
I
probiotic?
think it's the same, right? Same
Yeah.
that the same question that before. It's depends on the
Yeah.
type of probiotic in the mixture. So it's usually most of them are once a day, and
Hmm.
if it comes in a capsule, most of them is one. But again, it depends on the mixture and the probiotics. Not all
Um,
are the same, right?
yes, exactly. From Jennifer, do you prefer a human microflora probiotic over other types? Do you find a difference?
I'm not sure I understand the question. Human microflora probiotic. Does it mean a fecal transplant? I'm not sure what's the human. Mm,
Jennifer, if you want to type in again, just to clarify that,
yeah,
that would help.
yeah.
Is there one
Most of the
probiotic?
probiotics are most of the probiotics are synthetic, right? The
Yeah.
majority. Mhm. What is a natural probiotic is a yogurt,
Yes,
fermented food, right?
exactly. Yep.
And
Um,
there will be human microbiota will be fecal transplant. That's a different, completely different. It's not a probiotic. It's you're transplanting a lot of like a stool, like a with good and bad bacteria. So that's will be different. But I'm not sure if that's what you meant.
yeah. Is there one probiotic strain that overall works better for most people compared to the other ones?
Hmm. So again, it's as you will see there in that table that I showed, the most study were Bifidobacterium, Lactobacillus, and Saccharomyces, right? So those are the three most studied, but doesn't mean that there has not been back-to-back comparison of which one is better than others. That's
Hmm.
why there is a lot of research that is needed here to be able to answer that question. Okay,
Yeah.
if I give to the same person bifido versus lactobacillus or Saccharomyces, is that better or not? I assume it may depend because studies in other conditions, not celiac disease, have shown that each one has different mechanisms. So, for example, irritable bowel, it may not be the same to give lactobacillus or bifidobacterium that has different mechanisms. So
Hmm.
it depends. I think we need more study to answer that questions, comparison of different probiotics.
And for the future of research, do you think, that question is going to be answered eventually?
Um, I think it needs a lot of research for to answer
Yeah.
the question. So far, what we do right now is the probiotics that we have that are gluten free, that has bifidobacterium, lactobacillus, or a mix of them. We try, right,
Okay.
and see how the individual react, because ultimately what it matters is how person feels, because if our
Yep.
goal is to improve symptoms, is how the person feels with that.
Okay, awesome. I think that answers a lot of these too, because a lot of them I'm seeing, what type of probiotic do you
Mhm.
recommend?
There
Um,
is no one single
yeah,
recommendation that works for everyone, right? So I wish that it was more simple, but it's not.
and
It's
easy. Yeah. Is it better to get probiotics from the food we eat rather than a supplement?
not. Mhm.
Yes.
So it's important to get
Hmm.
probiotics from the food, and if you get good probiotics, good yogurt, good fermented food, kefir, so they all
Hmm.
have probiotics. You may feel good and may not need to take any other like synthetic. So it's of course it's a worth to try always.
Yes, always food over supplements first, and then supplements as a secondary. Is it beneficial to take a probiotic for those without celiac disease?
Hmm. So again, it's so when out of celiac disease, again, it's not my expertise of products on everything,
Yeah.
but it will depend because there are multiple of different probiotics with different functions for different things, right? So if the question is to stay healthy, what is stay healthy? It's like a feeling
Hmm.
better, quality of life. It is having better immune system, immunity. If it is having less respiratory infections, so
Yeah.
there are different strains for each of these based on how these bacteria act and based on the study. So it's I will say, in general, we don't take probiotics for any probiotics for everything. It's just with a specific goal, right?
Yep.
If you feel
Exactly.
good, you're healthy. You know,
Exactly. You don't need
just
to.
eat, you just need to eat
Yeah.
healthy and keep doing what you're doing. That you're healthy. There is no evidence that it will uh, improve anything if you're already healthy.
Yes, exactly. And healthy looks different for everyone too. So, from Veronica, once you start a probiotic, is this something that you have to take forever? Do you think results will go away once you stop taking them? That's a good question.
Right. Yes. So all are good questions. And
Yes,
thank you for asking them because again, I'm sure that when we ask one of these questions, someone else will say, "Oh yes, I have that same
I
question."
know.
So, but this specific question, it's true. As I think there was another question that they were saying that they were taking probiotics for years. Some probiotics may not work forever, right? So
Mm,
initially may work for several weeks, months, but as soon and but the situation changes, right? So with time, there are many factors that can alter again that gut microbiota. So maybe what worked before is not working anymore, and maybe we need to change the strategy. So it's not a probiotic something forever. If a person was working well and was feeling better and then stopped feeling better, so then it's time to change, right?
to change.
Mm-hmm.
Jeanette, when's the best time to take probiotics? So I'm not sure if she means,
Time of the
when
day.
you're newly diagnosed or yeah, maybe the time of day.
Time of the day. So most of them taken in the morning,
Yeah.
but it's if someone forgets to take it, you can take it at any time of the day. If that
Hmm.
was the question, right?
Yeah, or if you're taking other supplements or other medication, sometimes it's best to take it all together so you don't forget to. We have a few more minutes here. I'm just trying to go through. You taken on what foods are best or good sources of probiotics and what amounts are appropriate?
Mm-hmm. So yogurt, so fermented food, right? So
Yep.
yogurt, kefir, kombucha. You
Yep.
can help me here, Kelly.
I know it's really all the fermented foods. And I don't think,
So those are the most commonly, but there are, for example, broccoli. I know that those are prebiotics. That's
yes.
probiotics. So you can, if you get some fiber as well, some prebiotics, and you stimulate the bacteria you have,
Hmm.
right? So fiber is a very good component, and fermented food definitely that gives the bacteria directly or the yeast.
Yep. And even incorporating just more of them in your diet, I think is appropriate. So out of the 22 tested
So
probiotic,
So
oh,
in terms of quantity, I want to answer that because again, there is no exact quantity of fermented food that you can get, but
yeah,
what is it's a is reasonable, and you need to listen also your body, right? So if you overdo it, you may
exactly.
induce diarrhea because your body will not be able to digest all of that, and it will run, right? It's kind of a
Yeah.
so it's not to over to unfold.
Yes, and they're hard to overdo too, the fermented foods, but incorporating them as much as you can would be helpful. So I think we're pretty much at time. I'm sorry that we didn't get through all of them, but I think we got through majority. Again, lots of interest on this topic. Um, it's it's really people are always thinking about it. So thank you so much. And it's exciting to know that there's more research being done. I know that you said there was one question about the clinical trials and how to sign up for them. So I believe it's in on the McMaster
Website.
website, but I'll also include a link in the follow-up email for you. So thank you so much. It was a great informative session on all the latest research. Again, a quick reminder, tonight's session was recorded. We'll send out the replay along with any relevant resources and a survey too. If you found tonight's webinar helpful, stay connected with us through our website, our newsletter, our social channels. Keep an eye out for future events. Have a great evening, everyone, and thanks again for being here. Thank you, Ines.
Thank you very much.
Bye, everyone.